Greetings, loved ones. Today we're going to talk about the different phases of trauma recovery. Help us get these messages out. Please subscribe to our YouTube channel, follow us on Facebook, Instagram, and Twitter. Hit the like button and that notification bell, and please share these messages with others, because by doing so you could save a life. So let's talk about the phases of recovery. Recovery is the primary goal for people who have experienced trauma, their families, and their care providers. Recovery doesn't necessarily mean complete freedom from post-traumatic effect. Excuse me. Recovery is an individual experience, and we will be looking at how it is different for everyone. In general, recovery is the ability to live in the present without being overwhelmed by the thoughts and feelings of the past. Central to the experience of trauma is helplessness, isolation, and the loss of power and control. The guiding principles of trauma recovery are the restoration of safety and empowerment. Recovery doesn't necessarily mean complete freedom from post-traumatic effects, but generally, it is the ability to live in the present without being overwhelmed by the thoughts and the feelings of the past. There is a vigorous debate in the field of traumatic stress as to whether revisiting traumatic memories is necessary for healing, or whether it may in fact even be harmful. Obviously, this is an individual matter. Many may find it beneficial to tell and retell their experiences of trauma, where others may find that destructive to their well-being. Trauma recovery is best to be looked upon as a process that is worked on over time and in intentional stages. The reestablishing of safety is the first and most central step in recovery, separate and apart from whether the details of the trauma are ever spoken of. Dr. Pierre Janet conceived of a phased framework of trauma recovery in the late 1800s, with Dr. Judith Herman making it more readily known in her seminal work, Trauma and Recovery. So we're going to talk about the phases. Phase 1 is safety and stabilization. People affected by trauma tend to feel unsafe in their bodies and in their relationships with others. Regaining a sense of safety may take days to weeks with acutely traumatized individuals, or months to years with individuals who have experienced ongoing chronic abuse. Figuring out what areas of life need to be stabilized and how that will be accomplished will be helpful in moving toward recovery. For example, a person who has experienced a trauma may struggle with regulating and soothing difficult emotions in everyday life, which they might not associate directly to a trauma. Learning how to regulate and manage these difficult and overwhelming emotions is important. Some people who experience trauma, particularly complex trauma, may find that speaking about their experiences is emotionally overwhelming. Recently, both therapists and researchers have been exploring nonverbal ways to foster emotional regulation. Several studies have suggested that mindfulness-based stress reduction, or MBSR, groups and the use of acupuncture for clients with post-traumatic stress disorder reduces negative emotions and promotes a calmer appraisal of life situations. There are other types of self-soothing practices such as meditation, deep breathing, yoga, qigong, as well as other spiritual and cultural practices and ceremonies that have been shown to be effective in soothing the nervous system. You can refer to the topic on mindfulness and other related topic areas. These practices work well with more traditional talk therapies, allowing greater stability throughout recovery. Auricular acupuncture has the added advantage of reducing cravings for alcohol and drugs, as well as promoting better sleep and clearer thinking among clients who receive it regularly. It is also suited for supporting work with refugees and immigrants in that it is nonverbal and closer to the methods of traditional medicines found in a variety of cultures. So there's a metaphor for creating safety, and this is the experience of emotional overwhelm is similar to that of a shaken bottle of soda. Inside the bottle is a tremendous amount of pressure, and the safest way to release the pressure is to open and close the cap in a slow, cautious, and intentional manner so as to prevent an explosion. This was a quote from Rothschild in 2010. So let's talk about phase 2 of healing. This is remembrance and mourning. Phase 2, this task shifts to processing the trauma, putting words and emotions to it, and making meaning of it. This process is usually undertaken with a counselor or therapist in group and or individual therapy. It might not be necessary or required to spend a lot of time in this phase. It is, however, necessary to be continuing to attend to safety and stability during this phase. Attending to safety allows the person affected by trauma to move through this phase in a way that integrates the story of the trauma rather than reacts to it in a fight, flight, or freeze response. Pacing and timing are crucial during this phase. If the person affected by the trauma becomes quickly overwhelmed and emotionally flooded when talking about their trauma memories, safety and stability must be regained before moving further on with the story. The point is not to relive the trauma, nor is it to tell the story with no emotions attached. This phase involves the important task of exploring and mourning the losses associated with the trauma and providing space to grieve and express their emotions. So let's go to phase 3. This is reconnection and integration. In this phase, there must now be a creation of a new sense of self and a new future. This final task involves redefining oneself in the context of meaningful relationships. And through this process, the trauma no longer is a defining and organizing principle in someone's life. The trauma becomes integrated into their life story, but is not the only story that defines them. In this third stage of recovery, the person affected by trauma recognizes the impact of the victimization, but is now ready to take concrete steps towards empowerment and self-determined living. In some instances, people who have experienced trauma find a mission through which they can continue to heal and grow, and such as talking to youth or peer mentoring. Successful resolution of the effects of trauma is a powerful testament to the resiliency of the human spirit. Recovery is an individual process, and it will look different for everyone. There is an intense desire to feel well quickly, and individuals can feel that the process is taking too long or they are not doing it right. Recovery is not defined by complete absence of thoughts or feelings about the traumatic experience, but being able to live with it in a way that it isn't in control of your life. It's important to be gentle and patient and compassionate with yourself as you move through this healing process. Everyone has a right to have a present and future that are not completely dominated and dictated by the past. That's a quote from Karen Sackvitney. Remember, the question is not if you will encounter a victim of trauma or violence. The question before God is, what will you do when you do encounter them? You could be the person who saves a life. You are called. We are all called to be champions for justice. Those who suffer violence, they need to know that those who love them and those who don't even know them will reach out to them and give them the help and the courage they need before it's too late. If you're a victim of violence, I want you to listen to me. I really want you to know that you are valued, you are loved, you're intelligent, and yes, 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 you are worthy. God doesn't want you to suffer trauma or violence. He wants you to heal and live free from violence in peace and tranquility. And I want you to know that there is a way out. There is a way to heal. It's not your fault what happened, and those who abused you didn't love you, because abuse is not love. Most of all, I want you to know that you are not alone. If you're a victim of trauma, get the help you need. If you're a victim of violence, reach out to someone today. If you find yourself in a dangerous situation, dial 911 for help. If you know of someone suffering trauma, come alongside them and help them. If you know of someone who's suffering abuse, tell the authorities. In our next episode, we're going to talk more about recovering from trauma. Until then, God bless you.